hereditary ataxias oftentimes are caused, they're caused by a variety of different genetic mechanisms, but one of the ones that comes up frequently are diseases that are caused by these triplet repeat expansions. And so with that in mind, how does that impact your decision to order genetic testing, in terms of choosing a lab for genetic testing and choosing a test overall, just knowing the sort of genetic diversity with the hereditary ataxias?
It's a great question. First of all, I think one needs to have a high index of suspicion that, I do believe that diagnostic testing and investigation starts with getting a good history and doing a physical. I do believe that that is part of a diagnostic investigation. Talking to the family members, and even if they don't have a family history, looking at the phenotype of what they have, particularly a triplet repeat ataxias 1, 2, 3, 6, 7, they have certain phenotypic traits, although there is a lot of phenotypic overlap. They have cerebellar and non-cerebellar symptoms. If one has knowledge of these phenotypes, then one can proceed towards genetic testing of triplet repeat disorders, which also includes Friedreich's ataxia. And not all next generation sequencing or whole genome sequencings sequences identify large triplet repeats. So there have been times in which I have tested first for triplet repeat disorders and only then gone on to next generation sequencing. But currently the lab that we use, Variantix, has a methodology which identifies triplet repeat disorders as well as sequencing the entire genome. So I don't necessarily have to go to 2 different labs or do this in 2 different steps. And we're very fortunate that you're working with them to provide the genetic counseling bit. So that frees myself and the patient up to basically go down one direction instead of 2 different directions, and makes the process of genetic testing quite facile. When I am faced with a patient, or when a patient comes to me that I suspect may have a genetic ataxia, even though they don't have a family history, I keep these basic principles in mind, the principles of unstable repeats in triplet repeat disorders, which may not make a disease manifest, and then anticipation around the generations where the repeat expands and the disease is manifest. These are some basic principles of genetics one needs to keep in mind to have a high index of suspicion for testing for triplet repeat disorders, particularly the ataxias.
Some next generation sequencing tests and labs do have the capability of testing for these triplet repeat expansion diseases, but most of them do not. So it's a really important feature to look at, when you're choosing genetic testing and choosing what lab to use in terms of, do you need more than one test? Do you need more than one lab? Because sometimes it may take a number of different evaluations.
Right, and this is where genetic counseling becomes extremely helpful. People like yourself who are knowledgeable about the various testing procedures can advise the providers, go back and tell them, hey, you know what, you may need to order this before this if this is the patient's history and pedigree. It's difficult for us to keep everything top of mind with respect to genetic testing, and so it's so good to work with a genetic counselor who can guide the provider.